this computer. Well, welcome to our next session, interviewing a pharmacy leader in our profession. It is my pleasure to welcome this morning Dr. Mary McPherson, who is a professor and executive director of advanced postgraduate education in palliative care at the University of Maryland School of Pharmacy. And I've known Mary for a few years, some of it through my colleague who she's worked with very closely, Dr. Chris Herndon, on faculty here. And she also trained one of my students from Duquesne, Catherine Walker, who was one of my mentees. So it's been my pleasure to get to know Mary. And also, I was fortunate enough a few years ago to be on a site review team, an ACPE site team review for accreditation at the University of Maryland. So I got to know Maryland a little bit, and I was always impressed with the school. So let me turn it over to Mary, and we'll start off with maybe what we'd like to do is learn a little bit more about your journey to your position, your current position, and your recognition as a leader. And I consider you a leader in academia and also a leader in the practice community, and specifically in palliative care.
Well, thank you. Well, thanks for having me. I appreciate it. I live in Maryland. I went to the University of Maryland School of Pharmacy, where I certainly work now as faculty. And the plan was never to be an academic. It was just, ironically, a very happy accident that I stumbled into my career. So I would advise students to maybe give it a little more thought than I did, but I was very pleased how things worked out. But I knew that I wanted to do something in hospice because I had done I was in the old post-bac PharmD, a rotation in hospice, and I loved it. So I kept looking for a position that would not just be chasing gentamicin levels forever. And I was fortunate to find a nice job in Baltimore, which was 3 days a week in pharmacy and 2 days a week in home care hospice. But 4 years later, they did some restructuring, and I wouldn't have been able to stay in the home care hospice part. And I happened to be meeting with a friend at the School of Pharmacy about a presentation, and she said, I think we have a half-time open, because I was only half-time, my daughter was small. So I took that job. And then after I'd done that a few years, I think that's when things really started to change for me. We had an opening for the director of our non-traditional post-bac PharmD. This is when our school went to the all PharmD program. So I applied for that position and got it. So it was a little bit up the food chain, I would say, to be the director of that program. And I loved it. So, you know, I tell students all the time that I think one of the coolest things about pharmacy, and particularly being an academic, is the ability to reinvent yourself as often as you'd like. And I think I've done that about 5 times in my career, where, you know, sometimes I'm heavily focused on the clinical, other times I'm more administrative. I'm really interested in educational development. So it just seems like we've got these opportunities. While all of your balls are still in the air, you can change the focus. Mm-hmm. And I'm very, very fortunate at the University of Maryland. They indulge me in my craziness and, in fact, encourage it. So I'm very grateful to my chair and the dean for allowing me to do that. So I don't know how much deeper you want me to go into the trajectory, but that's kind of the 20,000-foot view.
Oh, that's great. And that's good. We're really getting to know people quite well through these interviews, and I really enjoyed that. Mm-hmm. One of the things, the next thing I really always like to ask people is, what do you believe is going to be your legacy in 20 years? And that's always a difficult question. And sometimes I rephrase that question as, what are you most proud of in terms of your contributions to the profession that has really helped to advance our profession?
Mm-hmm. I think I would have to come at it from a couple of angles. Number one, I'm very proud of the work that I've done, and others like Dr. Herndon, in pharmacy's involvement in palliative care. I mean, palliative care is not that old of a field relative to the field of internal medicine. We're about 40 years old, really, and it's a really sexy field right now. Everybody and their mother wants to get into palliative care. So to see the inclusion and the flourishing of pharmacy within hospice and palliative care has been quite rewarding for me. And my work has come from the clinical practice in hospice and palliative care, and my later career interest, where I more formally developed my interest in education as a science, not just an art. I've always loved teaching, but I mean, I was 2/3 of the way through probably my career when I decided I wanted to go back and get a master's degree in instructional design, and I did, and then another master's degree in distance education and e-learning. So between those two things and having practice in hospice and palliative care, my whole career, the time was right, all the stars had aligned to develop probably one of the only completely online Masters of Science degree in palliative care in the world. So I would say my work with colleagues in developing hospice and palliative care in the presence of pharmacy, my work to bring palliative care education to everybody in the whole galaxy. God knows I'm trying to do that. And part of my work in palliative care is I've developed an area of expertise in opioid conversion calculation. So I've written a text on that, and pharmacists really step up and embrace that. We love doing drug math. So I'm very proud of those things.
Yeah, that's great. And you said there was a second area, or there was something else in terms of you feel you're proud of in terms of your account.
I think it was my mid-career shift to really more fully developing my interest in the science of teaching.
Oh, okay,
So
gotcha.
I'm a big fan of pedagogy. So, which is, I know it sounds like I'm talking dirty, but it's self-determined learning. So yeah, I've kind of embraced that in my practice.
Got you. Well, very good. Thank you very much for that. The other thing I'd like you to share with us is what advice would you give for students in their professional journey? In other words, especially in particular, how they should develop as leaders, you know, in their journey. Any recommendations? And leadership, obviously, we're talking the little L. It could be the big L, but
absolutely.
Leadership.
I'm a big believer in personal leadership and leading by example and standing in your own power. I think you know, you hear the expression mover, shaker, troublemaker, and I think they wrote that for me, because I think it's wise for students to really develop their sense of curiosity. So if you go to pharmacy school and say, by golly, I want to be a geriatrics pharmacist. Okay, do a rotation in pediatrics. So this is your chance to cast the net as wide as you can. So you come in thinking this is the case, and you end up doing something entirely different. So really develop your sense of curiosity. And I often feel like a really annoying 2-year-old, because I'm always asking why? Well, why not? Well, why can't we do it that way? I really like to stir the waters that way. They certainly know this on my campus. In developing that master's, I felt like I was creating a university inside of a university, and I wanted to do all these crazy things that nobody had done before. But you have to be tireless and relentless, and don't take no for an answer. Mm-hmm. So I do think, you know, this is how I mean, every idea was crazy until the day it became reality. So
right.
I'm the queen of a workaround. I think that's important, is don't just accept no as the answer, unless you really are out there on a limb, but talking to colleagues and making sure you have a well-developed plan and continuing to explore.
So you don't take when people say, well, but, you definitely never say but.
Correct. Or we've always done it that way.
We've always done it that way, exactly. Well, I think that is a really accurate depiction. It really reflects how you have helped advance the field of palliative care. You know, having a vision and willing to pursue it, and it may seem like a crazy idea, and often people will say the reasons why you can't do something, as opposed to, oh, let's see about doing that, and it may not turn out exactly as you first thing, because sometimes we definitely don't know all the details. Well, that's great. I think this is really good. I think the students are really going to get a pretty good insight, as we've been talking to different leaders about what leadership is all about, because I don't think most students have ever reflected on what it takes to become a leader and what a leader is. So the next question, and I incorporated this question because it's I'm going to be teaching a history course, and it's 2020, and we would never envision where we would be today, in a month now. Here you are in your beautiful home, and I get to see all these beautiful books, and working from home, and the whole changes that has been necessary because of the COVID-19 pandemic. And in 10 years, as we are discussing the decade of the 2020s, we'll look at COVID-19 pandemic as a major happening in this decade, no doubt about it. And I think I strongly believe that we'll also see this particular event as a major milestone or major turning point for our profession. So that's kind of the question is, how do you see this as an opportunity for the pharmacy profession, this pandemic? Because I believe, you know, in 4 or 5 years, we'll be looking at in 10 years as we study this decade, we'll see, like we did with other decades, when, you know, in the 60s, when enactment of Medicare and Medicaid and all the other significant events in our transformation of our profession to where we are today. I think we will see this pandemic as also a major milestone in our profession. And as an optimist, it will be an opportunity for our profession. Can maybe share your comments in that regards?
And I think not just pharmacy. If I could marry my two interests of pharmacy and palliative care, I mean, I have several thoughts on this. My sister is a community pharmacist, and she's out there on the front line, the same as, you know, maybe not in an ICU unit, but I mean, you never know who's going to walk into your pharmacy. And again, this holds true that the pharmacist is the most readily accessible healthcare provider to people in the community. So they all flock to the pharmacy. So I think that's one. And aside from just general education and public health measures that community pharmacists can bring to the table, I think that I very strongly believe that all healthcare providers should possess primary palliative care skills, which is communication skills and goals of care setting and pain and symptom management. So when you look at COVID, this is a devastating, obviously, illness. And obviously people are having fairly abrupt endings. And we're hearing about the psychosocial issues of families can't even say goodbye to their loved one if they're dying. They're very, very symptomatic. Yesterday, I was on a conference call with actually your old advisee, Dr. Catherine Walker, who is now the medical director of palliative care for all of MedStar healthcare system, which is about 10 hospitals strong.
Wow.
So they were talking about if someone's on a ventilator, you're trying to wean them off the vent because they are terminal now, and we're running out of IV morphine, hydromorphone, and fentanyl. Now what do we do? So pharmacists have really stepped up to the plate. And the other thing is both hospice and palliative care have really, really stepped up to the plate. For example, when we talk about those families who are grieving horribly but couldn't even say goodbye, hospices are embracing those families and providing bereavement services with no compensation at all, because it's the right thing to do. And palliative care programs, for example, Dr. Walker, all of the pharmacists throughout their entire healthcare system in palliative care they've created something, they're calling it the bunker, but basically it's palliative care telehealth. And they are providing 24-hour coverage for all of the hospitals in managing the COVID patients, whether it's pain management or secretions or something else. So I think palliative care is going to come out of COVID, as well as the services of pharmacy, as some of the silver linings.
Exactly. Wow. I never thought about that because I never kind of recognized that hospice palliative care is involved with bereavement services. I mean, I never really thought about that. I always thought of it as, you know, making the patient comfortable as they're in their end life. But wow, it's amazing because I find it's so difficult. I know I had a friend who just passed away, not from COVID-19, but her family, they can't do anything in terms of the normal grieving process. And it you know, they weren't able to see her as she died, and obviously planning for memorial and everything else. It's part of that trend. Wow. Yeah, this is, yeah, it is. Wow. A silver lining in many respects in terms of a positive thing for the patients. I really, yeah, that's great insights. Well, I appreciate this. Thank you very much. I don't know if you have any other things you want to share with us, and I'll stop the recording and, you know, before I cut off here.
All your students to sign up for my online palliative care. They can take 1 or 2 courses. There you go.
Oh, yeah, I saw that. That's really great. That's wonderful. One of the things I'm going to be doing is this course that I'm offering. I'm hoping to offer, because it's an asynchronous or throughout the country as well. I'm actually probably going to be looking for a partner in terms of another program that's willing to partner with me on that, to offer through their institution. I'm getting close to retiring. I may not retire now because, you know, if we can't travel, I'm not so sure if I will retire. I will just continue to work.
There you go.
I'm tired of cleaning, so. Well, thank you very much.